We can treat anywhere from the lower limb to knees to ankles to feet. I work with diabetic wounds. I treat diabetic patients. I perform nail surgery, giving exercise routines so patients can stretch and strengthen muscles to stop pain, help control pain management. So I did my GCSEs, then did sixth form. Decided halfway through sixth form I didn't want to be a teacher anymore, and went to college and did medical science. When I was at college, I went to an open day at the University of Northampton and fell in love even more with podiatry, and then joined. At least one science subject. Podiatry is quite science-based, so there's the biology, which is your anatomy, your chemistry, you have to look at certain drugs, how they work, how they react with the body, physics with kinesiology and looking at gait and how the foot works and how you can work with that to improve a patient's pain. Do the daily checks and then print a list off, see which patients are coming in, have a quick look at new patients and what their referral is. And then really it can vary from writing letters to GP, doing vascular and neurological assessments, treating wounds, doing an MSK assessment from head to toe. Working with people can be quite hard sometimes, in the fact that trying to get someone to take responsibility for their foot as well as the care you give them in a clinic can be quite hard sometimes. Podiatry as a spectrum is just so broad. Physiology, anatomy and kinesiology, so we looked at gait. You look at orthopaedics, you start playing with insoles, making insoles, looking at shoes. You start nail surgery and you look at sports medicine and podiatric medicine, as well as looking at wounds, so getting you ready for when you go out into the NHS, and it's just so broad. There's certain things that you don't get taught at university, like forensic podiatry, so you'd look at gait analysis and to prove someone was at the scene of a crime, or how they alter their gait to try and prove that they weren't at the scene of a crime. So you definitely need people skills. You need to make sure that you're keeping professional standards and you're being quite assertive in what you're saying. So making sure that you're quite firm is always quite handy. Quite often deal with amputees, and you always ask the patient, should we have a look at your other leg? And a patient said to me, well, it was chopped off in 1966, so if you want to have a look at it, be my guest. I'm not sure what state it will be in.